advice. Focus for today is on flexibility and mobility. And this is going to be a discussion that provides some form of basic insight as it relates to flexibility and mobility. Uh, from my angle as a fitness professional, you know, assisting persons with the improvement of their flexibility and mobility is significant in the areas of reducing their risk of injury, improving their performance, improving their health, and overall just improving their overall quality of life. It is very important that as a person who will embark on an exercise regimen, whether it be for rehab or it be for fitness or it even be for sport, that you understand the concepts flexibility and mobility. Both of these concepts are similar, but they generally speaking have some form of contrast. So to actually start this off in terms of providing that degree of insight relating to what is flexibility, what is mobility, what is the difference between the two, I am utilizing the article provided by the American Council of Exercise to provide that degree of reference. So this article, Mobility versus Flexibility, Why the Difference Matters for Movement and Performance. This is an article by American Council of Exercise, certified, and this is a May 2026 article. So generally speaking, the part that I'm going to reference is a table. And this is a table that highlights characteristics of flexibility and mobility. So in terms of characteristics, what it is that it has highlighted is that there is a primary emphasis, what is required, and common methods, best programming uses. Flexibility is said to, be available, or it involves passive range of motion and is specific to the tissue length and strength tolerance. Mobility is more so focused on active control through available range. Flexibility requires extensibility of muscle and connective tissue. Mobility is flexibility plus strength, coordination, balance, and motor control or neuromuscular control, nervous system control. Common methods of flexibility include static stretching, prolonged holds, and passive positioning. For mobility, you will have dynamic drills, controlled joint motion, and movement-based patterns. So as you can see right there already, flexibility is stationary, holding or extensibility, holding a position for a period of time. And, that is where you're more so focused on flexibility. And based on what is highlighted here, mobility will involve more so dynamism in terms of the movement pattern. So it's not just holding the position in terms of the stretching position, but it's you engaging movement towards enhancing mobility or range of motion. Now, in terms of flexibility, the best programming approach is to incorporate flexibility at cool downs, and mobility is best to be incorporated during the warm up. Now, just a party alone is a critical highlight in the context of exercise programming, because generally speaking, there exists within the exercise space uh, flexibility that is incorporated in warm up. So people can be asked to hold stretches to assist them with warming up. And this is something that is relatively present throughout the world generally. A lot of instructors will ask their clients to do a particular stretch, and this is engaged in the warm up segment. Now, what it is that is actually being highlighted here with this new publication is that stretching in this respect should actually be done during the cool down. What should more so be done during the warm up stage is the dynamic mobility exercises, right? And in other words, working on mobility itself. So techniques that will work on, improving the range of motion of joints. That is what is being recommended as it regards to when to use the tool. So flexibility, use that at the cool down, and mobility, more so use that at warm up. So that is a critical takeaway right there. So as it summarizes, flexibility reflects passive capacity, mobility reflects active control of that capacity during real movement. So when you know are focused on, let's just say, a specific exercise, or even to, let's just say, improve the degree of or release the degree of stiffness that you may experience in a particular body part, right? Flexibility, extensibility of that particular area. You focus on, trying to lengthen the muscle, focus on trying to lengthen the connective tissues. And mobility, it incorporates that, plus the reality that you're also trying to ensure that there's a degree of dynamism in terms of being able to have the full range of motion of the joint involved be also incorporated for that specific movement plane in and of itself. So if I'm going to use any form of visual, finger as an example, this is an example of, me carrying it through an exercise geared towards flexibility, right? So here it is, as it is right now, without me putting any form of passive stretch to it, and this is me putting some form of passive stretch to it. So in by doing so, the flexibility has increased, and it's a case where stretching is taking place of tendons, and in addition to that, to the muscle itself. Right? Mobility can be this kind of exercise, right? So it involves also the movement of the joint within the knuckle itself, or depending on where exactly we want to even put it at a more so closer area related to these digits here. That's basically mobility in that respect. So when you think about it in that context, you doing flexibility exercises, you do this primarily in the cool down, and you more so focus on these kind of mobility exercises during the warm up stage. That's basically a key takeaway in that area of the exercise programming. All right. So I will like mentioning or giving some insight as it relates to different segments of the population, and what it is that I can see from my experience as it relates to flexibility and range of motion. What it is that I would also mention is that for those individuals, women who would have been pregnant or who are pregnant, what it is that they can experience is an increase in the overall, let's just say, range of motion of specific areas within their body, right? So in that respect, that would then mean that where it comes to certain kind of movement patterns for pregnant women, this is a reason why where it comes to exercise programming, when as they go through different trimesters, exercises have to be tweaked to not necessarily place them at a greater risk of, let's just say, having greater expansibility of the joint in focus, right? Because generally speaking, their range of motion is going to be increased because of the fact that they have their hormones already going through that shifting in that respect. So with that segment of the population already being exposed to a greater range of motion, the exercises would have to be somewhat tweaked and not have to expose the joints to its fullest capacity in terms of how the movement pattern will be displayed. All right. So typical areas that we have to think about when it comes to areas that can be tight or can be actually freed up in the area of women per se. Tightness, lower back is one general area that we can say, yes, we can experience some form of tightness. That is a common area. Similar to that, it can be a case that people can experience tightness in the ankles. Generally speaking, from my recollection as well, people after they have finished a hard day at work, the ankle can be stiff. So many persons can even experience swelling of the ankle joints, ankle joint itself. So with this being highlighted now, conducting exercises to assist with flexibility and a degree of range of motion exercise as well, to ensure that where it comes to the movement of the ankle joint itself, the ankle joint is not being so much in a restricted capacity. That is a consideration where it comes to how the flexibility and the mobility will be tied into each other to assist with providing relief for the said person. Uh, Similar or contrast to that, an individual who is already hypermobile or hyperflexible. So, for example, again, going back to the pregnant woman case, let's just say, for example, where she is concerned, her hips already are in a state of being a degree of increased elasticity, then in so doing, it would then mean that if she were to work with, let's just say, her trainer in this respect, the trainer would have to then tweak the exercise, let's just say the squat, where the squat does not necessarily place that individual to a great degree of hip flexion. And in so doing, it also then would result in a degree of opening of the hip joint in and of itself. And that in and of itself then can result in a degree of greater risk of injury for the connective tissues that surround the hip joint. That is where the tweak will come in, whereby that pregnant mother will then be asked to not necessarily do a full squat, but to then do, say, for example, a half squat or to do a quarter squat. All of this is the practical element in terms of where flexibility and mobility go into practice where it comes to the administration from the exercise professional point of view. But similar to that, the reason why this is important for you to know is so that when take into consideration your approach towards providing some form of relief, neck tension, back tension, that kind of a thing, and let's just say it is attributed to tightness, then it is important that you understand that flexibility should be considered in a way that is not necessarily also being said to be the same as range of motion, because range of motion involves more dynamism in terms of the movement, not just of the muscle tendon unit itself, but also of the connective or the supportive units as well. So let me see what else. So as the article goes on, why mobility is foundational for moving well. So as it says, the human body does not move one muscle at a time. Walking, getting up from the floor, lifting groceries, climbing stairs, etc. All of this require multiple joints and tissues to work together in 3 dimensions. And because of that, mobility should not be viewed as separate from movement skill. Rather, it is one of the foundations of movement in and of itself. So if we're talking about moving appropriately or moving within our fullest capacity, then mobility must also be involved with our overall training program, right? And when you think about mobility, you have to take into consideration that it's not just about the muscles that are the prime movers of the joint that you are considering, but you also have to take into consideration the stability muscles as well, or the stability units as well, that are being put into action towards supporting mobility. So if we're going to talk about, trying to incorporate hip mobility standing, then you would have to have on the opposite side the knee joint, ankle joint working in unison to provide stability so that it can carry the hip through its range of motion as how you would want it to go through. So what this is highlighting, to have good movement, you need to have good mobility. All right. Let me see what else. What's another section about it now? Not gonna go into that part. So it gives some examples of the different sections of the human body where mobility or movement and stability go hand in hand. So foot and ankle complex. Mobility here supports gait or overall movement mechanics. Squat depth and shock absorption are examples of movement patterns that involve the foot and ankle complex. Limited dorsiflexion can change movement strategy all the way up the kinetic chain. So as I would have said earlier, if you have tightness in your ankle, then generally speaking, your movement will be affected. So dorsiflexion, using my wrist as an example, this is an example of dorsiflexion right here. And in a sense, if we're talking about your range of dorsiflexion being limited from the ankle joint itself, then it would then mean that your squat will be limited. So persons who will do squats, and let's just say, for example, we see their heels lifting off the floor, that can be partially attributed to, let's just say, reduced mobility or dorsiflexion of the ankle joint. So that's a reason why those individuals will be recommended to do exercises to improve the range of motion within the ankle joint, to improve the dorsiflexion range of motion, that is. All right. So that is what is being highlighted here in terms of the foot and ankle complex. It's that the foot and ankle complex is very critical in ensuring that if we want to have good gait, you need to have optimum mobility of foot and ankle joints. All right. If you want to have a good squat, you need to have optimum mobility of the foot and ankle joint, in addition to others as well, but just mentioning the foot and ankle joint. Now, in terms of the hips, it says that the hip is a triplanar joint. So it moves in three different planes of motion. That's what the hip does. And that's the reason why, the hip is one of those areas of the body that you will say, oh yeah, in terms of its function, it's very, very magnificent. You can have flexion, you can have extension, and there's also abduction, adduction. That's how the hip can move. So this now is saying that in the context of mobility, making sure that you have ample mobility of the hips will ensure that you have good functional mobility overall for the different planes of motion for the hip itself. All right. So when we talk about flexion, it's, say, for example, lifting the knee up to your waist. You talk about extension, it's you, say, for example, standing up from a seated position. You talk about abduction, it's you lifting your leg away from the center of gravity or your center line. And you talk about adduction, it's you moving your foot from as far out and bring it back to your center line. All of those different planes of motion are involved with the hip. And you making sure that you have ample flexibility of the muscle units and the tendon units of the hips. So we're talking about the overall gluteal complex, you talk about the hamstrings, you talk about the groin or the adductors. And in addition to that, you're making sure that the overall supportive units in and of themselves as well are also functional. The ligaments itself, as an example, that that combination of flexibility and mobility will assist with ensuring that the overall function, the triplanar function of the hips, can be in its optimum state. If you notice that it's hard for you to lift your knees up, then you have to address that through flexibility exercises, mobility exercises. If it's hard for you to, say, for example, straighten up your hips from a standing position, let's just say, for example, that you have your body somewhat crouched forward, then that can be attributed as well to tightness of the front of the hip, and in and of itself as well, because of the fact that there is a degree of tightness in lower back as well, as an example. All right. So these are the ways how you look at it. The body moves as an overall chain. So you have to just understand, which anatomical structures are to be taken a look at when it comes to trying to provide some form of correction to the movement deficit. Thoracic spine. So thoracic spine focus on extension and rotation in the upper back. And through the movement pattern of the thoracic spine, it helps to spare the lumbar spine and improve overhead mechanics. So essentially now, individuals who do, let's just say, overhead exercises, shoulder press. I have seen persons doing the shoulder press, and let's just say they are not able to have a full extension of the hand going over. Right. So to some degree, that can be attributed to a reduction in terms of the overall mobility of the thoracic spine. Right. So by improving the overall mobility of the thoracic spine, it can assist with overhead exercises as well. That is what is being said here. Similar to what I've highlighted with the thoracic spine, the shoulder complex. So I mentioned that the hip complex, or the hips, is one of the most magnificent areas of the body because of the fact that it can move in a triplanar motion. or triplanar manner. Similar to that, you have the shoulder complex. And shoulder mobility depends on the coordinated motion of the glenohumeral joint, scapula, thoracic spine, not just the shoulder joint alone. So I mentioned the thoracic spine as a critical section of the body that is important for overhead movement patterns. But what it is also highlighted here for in terms of your shoulder complex is that the shoulder complex depends on the thoracic spine being in its optimum mobility. In addition to that, the glenohumeral joint, right? And in addition to that, the scapula. So if it's a case that, let's just say, for example, your shoulder blades are, feeling restricted, then generally speaking, you can expect that your shoulders will not necessarily function in its full range of motion. All right, because the shoulders can have overhead movement. The shoulder basically can have retraction, pulling the shoulder blades together. It can basically have abduction, and it can have extension and internal rotation, or external rotation, internal rotation. All of that, in terms of the shoulder complex, depends on glenohumeral joint, scapula, and the thoracic spine working in unison. And these supportive structures have to be in their optimum in terms of being, fully mobile, so that you can be able to experience, the kind of movement patterns of the shoulder joint without restriction. So, with all this being highlighted, it is just briefly bringing to your attention the relevance of flexibility and mobility towards you being able to experience optimum function throughout your activities of daily living, towards your fitness development, and for rehab and sport performance. That is what all this is highlighting here. So, making sure that you know the difference between the two, flexibility, mobility, that is what this is being highlighted, and knowing as well when to incorporate flexibility and mobility. Flexibility is said to be best incorporated, and that is static flexibility, that is best incorporated during the cool down, and mobility or dynamic movement, range of motion movement, is more so recommended during the warm up stage. When you understand these concepts, then it can go a far way towards helping you approach your exercise in a safe manner and in an effective manner, for the long term period. Yeah, so that is that for this discussion. And yeah, next discussion, which will be tomorrow, yeah, you can tune in for that as well. So thank you very much for tuning in, and take care.